Good morning. This is a initiative of One Good Step and Dr. A V Bhandary Memorial Hospital. Last video I discussed about this one of the most important problems which we see in our clinic, that is patients coming to us telling about their past in the sense things like I would put a word called as adverse childhood experiences. They discuss about various forms being neglected by family, being made fun of. It starts with the psychological neglect, psychological maltreatment, physical abuse, punishments, and of course sexual abuse. So many of the psychological problems we see in our clinics, if we really talk to them, if we really investigate the core reasons behind these particular things like um depression, anxiety, post traumatic stress disorder, we find that these adverse childhood experiences have a very big impact, which has caused this. So now many people do not come out. Many people do not know what to do. In fact, when we started this series of videos, I told you about 4 A's: awareness, acceptance, analysis, taking action. This same thing holds good here. Many times it becomes hard for us to become aware that certain psychological symptoms which we are facing are because of the abuse we have undergone in childhood. So becoming aware of it, becoming aware of this is what we call as grounding, becoming aware of these symptoms, connecting it to psychological past. So becoming ready, accept it. Okay, this is something which is bothering me, and I think I should go and take help from a professional. Then, of course, accepting. Then, when you go to the professional, in fact, what happens when you meet a psychiatrist or a clinical psychologist or a psychiatry social work consultant? These are the people who are trained in talking to you. In fact, you should ask your doctor whether he is interested in this, whether he can give time for this. When they have had abuse, we discuss with them. We discuss, it takes lot of time, lot of sessions. So basically the aim is to recollect what are the events that have happened in the past, and also make them aware that how it is affecting their present. So in fact, we use cognitive behavior therapy techniques. We sit with the client, discuss about the various things that have been bothering them and how they can come out of it. And basically a discussion involves more of, one is ventilation by the patient, and of course during this time we come to know about various cognitive errors the client has made. One of the most important thing is all of us should understand that if we have been abused in the past, physically or sexually, it is our body which has been abused, and this has bruised our mind. So it's high time we try to understand the connection and also understand that we need to do something to change the these connections. In fact, research talks about brain's neuroplasticity. It's the capacity to what do you say, change the connections of the past, the hurt that was there in the past, which has been affecting us. In fact, I have discussed in the last video about how things like post-traumatic stress disorder, anxiety, depression, and even some of the physical diseases like heart disease, stroke, all this is related to adverse childhood experiences. So when we sit and talk, when we sit and recollect the past and also try to reinvent a new meaning by changing our distortions, some of these negative thoughts we have, we are able to come out of it. India is a country where there is a acute shortage of psychiatrists and clinical psychologists. So there are people who are trained in handling these victims of child sexual abuse. And in case you come across a child who has been abused, he or she comes and tells you, please guide them properly. Please guide them that they should meet a professional. In fact, lot of activism has taken place, lot of child helplines. Child helplines 1098, this is the number of this child helpline. If your child is abused, if your child is physically or sexually abused, your child should be encouraged to talk to child helpline volunteers. You can meet them, and many a times if they feel there is a requirement of a professional to intervene, they will refer you. So child sexual abuse is a problem which can affect our adulthood. So it is high time we accept it. If we have been abused, it is high time we discuss about it. We come out with our feelings and try to rearrange our life. And again I repeat, awareness, acceptance, analysis with the help of a therapist, and taking action. Many times action involves long sessions of psychotherapy, sometimes medications, and of course some practices like mindfulness meditation, relaxation exercises. These are things which will help you. So this is an initiative of One Good Step and A.V. Baliga Memorial Hospital, but this is not a substitute for psychiatric consultations. Our aim is to bring to your notice common psychological events, common psychological problems that are occurring, and guide you properly so that you seek help. Please understand, these psychological illnesses are just like physical illnesses, and we need to take help. Taking help is not a sign of weakness, it's a sign of strength. Do comment about quality of our programs. Also, please guide us. If you want any programs, please let us know. We'll try our best. We try to limit the video to 10 minutes so that it doesn't waste your time, and of course you get complete information. Please subscribe our channel. Please encourage us. Thank you.